This is the most heartfelt work in 30 years that I've done. I love what I do. In 2015, the chief at that time came to me and asked if I would start a behavioral health unit. And he wanted to call it the community response team because we're responding to people in crisis in our community and trying to figure out ways to divert them from the jail, from the hospital, and get other services to them. And then we worked with our partners at Deschutes County Behavioral Health to obtain a grant to actually have a social worker work within our unit, somebody that can actually go out and assess people on the scene.
I'm able to ride along with law enforcement officers, so I'm involved every step of the way in the process. There when the call first comes out, and we're able to collaborate together to approach the situation, to hear all the information that's going on so that we can quickly respond and safely respond.
We also really like to focus on the service aspect of what does that individual need, or what does their family need for longer term success once they've gotten through the crisis, and realizing that people with chronic issues, it's a roller coaster where it's not just a one and done crisis. It's something that can be reoccurring. So let's be mindful of that and work to support them through their life.
To have a familiar face show up and to be able to form those relationships, check in with people, follow up with people, is, I think, something that people don't expect from a police department and can be so healing and so helpful.
It truly feels like we can come up with some suggestions or opportunities for longer term success for people that really makes a difference, rather than just the police stopping by for 5 minutes and then leaving.